Hi, good afternoon. I'm excited. How
Me
about you?
too. Me
You're
too.
looking great.
So are you.
Wow, wow. This is that nurse and this nurse.
Exactly.
Wow, 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 wow. I'm excited to have my pastor nurse here with me.
Amen. Amen.
And it's exciting to know that I did leadership
Mm-hmm.
for many years,
Mm-hmm.
but I actually did my final degree in nursing leadership.
Amazing.
And prior to being a nurse, I mean, full-fledged nurse,
Mm-hmm.
I remember teaching, going over to Devon House, that's in
Mm-hmm.
Jamaica, just across from the hospital where I
Mm-hmm.
was trained.
Mm-hmm.
And when we were doing the urinary system in particular, I remember group study,
Mm-hmm.
and my classmates would say, Miriam, you just do that so well. I trace the urine
Mm.
from, and it was the whole urine formation.
Wow.
And
Wow.
that was fun. And
Mm-hmm.
that has carried me through whenever I teach.
Mm-hmm.
Most times, I
Mm-hmm.
usually get that feedback from my students or
Mm-hmm.
my young nurses about the way how clear it is to them,
Mm-hmm.
you know. And I'm happy that I think it's a talent there.
Mm-hmm.
And I'm just so excited to have one of my younger nurses who is now doing ministry.
Amen.
And
Amen.
ministry, the spiritual aspect of the
Mm-hmm.
patient is so important. Sometimes, from your observation, you'll notice that uh, when the patient receives something spiritual, and especially those patients who are spiritual minded,
Mm-hmm.
they usually ask for their spiritual leader, whether it's a
Correct.
pastor,
Mm-hmm.
whether it's a minister or a
Mm-hmm.
clergy,
Chaplain.
chaplain.
Mm-hmm.
And I know you have played many roles, both in nursing
Mm-hmm.
and in surgery. So today,
Amen.
I want to salute you
Oh.
and all the others. And as a female minister, I really do appreciate because Deborah,
Hmm.
she was no play.
I know. Barack
Barack,
could not,
Barack said, I will not go unless you come with me.
even though she told him. Hmm. That's why
Wow.
a woman had to bring home.
This is really,
Amen.
this is really, really, really. I'm just charged up right here
Mm-hmm.
now,
Yeah, yeah,
recharged
yeah.
and invigorated.
Hmm.
So today, from the Empowering New Nurses show, I just want to welcome you on the
Thank you.
platform.
Thank
Coming
you.
way from Chicago.
Mm-hmm.
Wow.
Michigan, yeah, yeah,
Wow,
yeah.
wow, wow. I'm so excited that you're
Mm-hmm.
here. So on this show this morning, for those of you who don't know me, I'm Dr. Miriam Smith, the host for Empowering New Nurses, because
Amen.
we want to ensure that all our patients, every one of them, get the right care,
Mm-hmm.
the proper care, the diverse care, and the
Mm.
individualized care,
Correct.
culturally
Mm-hmm.
congruent care. And that's one
Amen.
of my areas that I like to
Yeah.
emphasize because we're diverse. We're
Mm-hmm.
diverse in so many ways.
Mm-hmm.
Education,
Mm-hmm.
we talk about race, we talk about nationality, we talk about ethnicity, and the list could go on.
Mm-hmm.
But we are diverse. But each person deserves that personal care.
Mm-hmm.
And so, as we embrace that and as we encourage our young nurses to do so, I want to hear your take on that. As a chaplain, when you enter or when you talk with your patient, what does that feel like? You know what? Before you continue, we celebrate Pastors Appreciation Month. This
Oh.
October, we also celebrate breast cancer awareness,
Mm-hmm.
domestic violence awareness. There are so
Mercy.
many that's
Yes,
being celebrated October. October is a special month.
it is.
So,
It is.
as a nurse,
Mm-hmm.
give the audience, our young nurses, some pointers. And at the same time, from the perspective of a chaplain,
So I'm not a chaplain.
as yet.
And yeah, and I don't think I'm going to be going into chaplaincy, but there
Okay.
are a lot of my colleagues that, like I am from a healthcare background,
Okay.
they lean a little bit more towards chaplaincy. I think I'm the weird one in the bunch where I'm like, no.
Okay. Well, that's okay. That's okay. But I know you have been in ministry.
Yeah,
So,
so it's exciting being a pastor. I'm transitioning from being a nurse into being a pastor, and right now I have dual roles. And it's really an honor to speak to you as a young nurse, whether you're in nursing school or you're a new grad or you're getting your master's, your NP. I support you. I salute you. It's hard being a nurse. Get your PhD, go get it, and be the best nurse you can be. Right now, I've had a new lens of nursing. I've nursed or had my nursing career predominantly in New York City.
Hmm.
Um, and I was hired as an oncology nurse in Indiana, and then as a unit nurse in the state of Michigan. And it really opened up my eyes because I think we're spoiled in New York. We have a lot of diversity here in New York City,
Mhm.
and we see people from different cultures, different backgrounds, different ethnic groups,
Right.
different races. In those states, it's not like that.
No.
No, it's very different. And I was
Let's hear about
asked
it.
to be, oh, mercy. So I am in seminary completing my pastoral degree. It's a Master's of Divinity. I'm adding it to my Master's of Nursing.
All right. Congratulations.
Thank you. And I was doing my PhD also at the same time for nursing education and informatics. And I was like, Lord, why am I doing my PhD for nursing and my master's in divinity at the same time, on top of all of my personal issues that I had going on? And I felt a little nuts, but I entered into Michigan and I started working as a nurse. And I think I'm one of three Black nurses in an entire facility, even the aides, the janitor, everyone. It's predominantly Caucasian. And so sometimes there tends to be like subtle, undercurrents of like microaggression.
Hmm.
Um, and truthfully, it's always one person that will be, the one that's causing this issue. And this is where the pastoral role came into nursing. I
All
prayed
right.
and I said, Lord, release me. Amen. And before I came here, like her last night was like Tuesday. So when I went to work on Wednesday before coming, she's no longer there. Be careful, touch not the Lord's anointed. I was working there and I was being precepted on my fourth day. And there were several attempts to get me fired on my fourth day of orientation. So it was
Wow.
very like,
Uncomfortable.
for sure. And it made me, just intensify my prayers. I was already dealing with a lot. And we all know that nursing is a lot. And so you just don't want any added stress that, you didn't foster. And so being in ministry, I'm still like the worship leader at my church. I'm the worship pastor there. We do AMD. We have mission trips that I'm going on.
Great.
I sing with the seminary choir. So we're literally a choir of pastors. We have to go out and serve the community. And we minister all around the different cities in Chicago, Michigan, and Indiana, Mishawaka. And so I'm learning how to be more diversified as a woman, as
Hmm.
a spiritual leader, and as a healthcare leader, because the role that I was appointed at my nursing job, they needed a nurse with the exact skill set that I had to do the job. And I thought, because of my skill set, my overcompensating, my overqualifications, that they wouldn't want me, but I still went ahead and applied anyways. And I was exactly who they're looking for.
Wow.
And so in leadership in nursing, I'm just going to pivot to what you were talking about in the book. Sometimes you may think, oh, I've done so much, especially like if you live in an inner city as a nurse and you have all these extensive experience with leadership, with your qualifications, with your certifications, and you may think, oh man, no one's gonna want to hire me, or I'm too young, I'm too new. I don't know if they'll accept me in the CCU fellowship. I don't know if they'll accept me in the NICU. I don't know if they'll accept me in the, don't limit yourself. I've learned something when I worked in Lenox Hill Hospital, and it's this. Most men are underqualified for the positions that they're applying for in nursing. And we all know that nursing is predominantly female, but we do have a lot of male nurses. The male nurses are less qualified than us. But, and this was the statistics that was done in 2017. It's the male nurses who are quick to apply for leadership positions and they'll get it. Not because they meet the qualifications necessary, but because they actually applied. So don't limit yourself. Just go ahead and apply. Even if you don't think you fit, you checked all the boxes. Go ahead and apply. Have the confidence that these male nurses have. Apply, apply, apply. Apply yourself and apply to your future. And whenever you go and you're working anywhere, just be confident in who you are. And if you don't know what you need to know and they hire you, nursing is so diversified, they'll train you.
Thank you so much.
You're welcome.
Thank you. You are a young nurse and you have done leadership.
Mm-hmm.
So, you nurses, young nurses out there, be an advocate for yourself.
Exactly.
There's a position that is there.
Mm-hmm.
Apply for it.
Mm-hmm.
Apply for it. Most places, most institutions, they will have, we would say, succession planners,
Correct.
right? So you will learn along as you go. Definitely, of course, you got to be qualified, but you might be qualified in something else, but not in the details of that particular area. However, the system has in place trainer, train the trainer. We have preceptors.
Correct.
We have preceptors, and there are many nurses who are willing to share their experience.
Exactly. And that's a big deal. I remember working with a doctor. She's an educator, a nursing educator. And I remember when I was a CNA and they were training us to become PCTs. And then I went to nursing school. She was so proud of me. And she said to me, "Oh, Katie, I've got to watch out for you because you may come and take my job." When because she had been the nursing educator at that hospital for many, many years. And I thought to myself, could I get my PhD in nursing? And now you can.
You can.
You can.
There's no limit. There's no limit. You just have to apply yourself. And
Exactly.
I tell you that it's not easy work.
Mm-hmm.
It's not easy work, but hard work pays off.
And it's rewarding.
Hard and it's
And
rewarding.
satisfying.
And let me tell you something. As a nurse who's been having experience in different areas, when you apply yourselves, there is no limit. You have questions, ask. Someone is out there to help you. Check the
Yes.
resources. There are many
And there are
resources.
more people that are willing to help you and rooting for you than those that are not. So don't get bombarded with those that are not supportive of you. Find your nurse tribe who'll support you, who will have your back, who will pray for you, and who will just encourage you to move forward. Nursing is always evolving. It is always evolving. And if you want to be a nurse for today, stay on top. Stay on top of your qualifications, stay on top of your certifications, stay on top of your licenses. Just stay on top of
Stay
it.
current.
And stay current. Exactly.
Join organizations that are moving ahead, organizations that you can get your place in. For example, make yourself visible. When there are times when, for example, staff meetings, show up
on time.
Don't hide behind in the back because this doctor is on or they're gonna do this wrong and so forth. Make yourself, it's okay to say I don't know, but you are valuable in the system. Your opinion counts, and you have to tell yourself that too. Don't go on like no, not that. Your point is as valuable as somebody else's. The patient talks with you. And I would say very often you can attest to that. The doctor comes in and they would come in and they go on their rounds and they might be rapid, they might be rushing here and there. But you are the person who is with the patient. And that patient will confide. That patient won't say anything sometimes when the entire team is there. Although we encourage the patient to be a part of the care plan, we encourage them to talk back and share. At the same time, they might just give quarter of it. Yet, when you're caring for your patient, whether you're giving medication or you're making the bed or you're setting up an IV and you have a conversation, that trust that is being there
Yeah.
and that relationship that developed, it
Mm-hmm.
does make a difference. That
Yes,
patient
it
will
does.
start pouring out their heart to you. You hear about the family over there and the brothers over there and who they just start conversing. And that is that helps in their healing process.
Yes, it does.
You know, communication is so important.
And it also allows them also, sometimes people are not comfortable sharing. So let's say they just answered the basic questions during triage. But when they realize that you care about them, they'll be more open about certain diagnoses, medications that they're taking. And truthfully, I've experienced that. That can also change the direction of their care with the interdisciplinary team.
Exactly.
And so sometimes, just fostering a sweet spirit or, a listening ear with with your patient or your resident, it can help change the outcome. I have a resident, he is so anxious, overly anxious, if you ask me. And a lot of the staff, they get very frustrated with him. And I understand why. It's a lot dealing with him. But this is a man that through me just saying, hey, why don't you come sit here with me while I prep the meds for the other patient? And he sits there and I give him like a Ritz cracker snack and I pour him some juice and he just sits there and he talks or he just, people watch. And while he's sitting there, I remember one evening, because I work nights, I asked him, what was your old job? And he's like, why? Why did you ask me? No one's ever asked me that before. And this quiet little man was just like, yep.
He just wanted that outlet.
He had the same job for 35 years. He worked in the same department. He had this. So, this is what this is telling you about your patient. This is a man who likes consistency. He likes some routine. And it just gave me a lot on how to actually work with him. And that, because of my note, the social worker had to come, his care plan changed. Like, we had to get him on a schedule. It's just like everyone gets their meds at this time, but when should he get it? Well, and those are the things that make or break you and your shift as a nurse. So
thanks for sharing that because it comes back to individualized care.
Exactly.
Customized care. So I just want to say thanks to you for coming on. But I have one last question for you. And that is, what would you tell our young nurses? You have been there, you have experienced diverse situations. What would you tell your young nurse, some of the expectations as they deal with different patients? Anything.
Be gentle. Be gentle with yourself and be gentle with your colleagues and be gentle with the patients. You have to be gentle with yourself. Let's say you wanted to be a nurse 10 years ago, but you're a nurse right now, or you're about to graduate nursing school. All the money, all the jobs, all the resources, they're going to be right there. Don't beat yourself up about what you could have done, what you should have done, and how you should have done it. You're here right now. Be gentle with your colleagues. You don't know what they're going through. And it doesn't make sense to take on anyone else's issues. If they're having a bad day, it's okay. They're having a bad day. Don't reciprocate that and mess up your own emotions in the process. Just be gentle. Be gentle with the residents, be gentle with the patients because they don't want to be there. They've got their own families, and truthfully, they'd rather be in their own home. So, a little bit of gentleness towards yourself will allow you to be able to extend it to others. And so that's it.
Thank you. Thank you. And I will just add something here. Self-care. As a young nurse, you might see so many shifts going and they might ask you and you say, okay. And they ask you again and you say, okay. But not every time you have to say, I have to be there.
No,
No,
is a complete
self-care is
sentence.
important.
Exactly.
Very important. So take care of yourself. Take those little moments, time out. Go to dinner, go to the park, walk out with a friend, have a good, positive conversation, and endeavor to treat people as people, human beings, regardless. And I'm going to emphasize this again, regardless of your culture, regardless of your nationality, regardless of your ethnicity, regardless of your color, regardless of who you are. Remember, that person is a human being and deserve the best, high quality care, as mentioned in this book. This book is written by whom?
Dr. Marion Smith.
And who is she?
Oh, she's right here.
Yes, thank you so much. And I know you have been a part of this book.
It
Do
is
you realize
on
that?
myself, yes, and I am a part of it. I think I'm a part of your foreword or
You're
your.
part of my book here.
Mhm.
And there is a little section here. And I just wanted to read maybe just a sentence about what you have said in this book. So beautifully put. That's her
Miriam,
right here.
yeah.
I want you to read that.
I wish that when I was a nursing student, I had access to the gift and enjoyed the proximity of a mentor as qualified as Dr. Smith.
Thank you.
The impartation of wealth and knowledge to both new and seasoned nurses provided in this book are second to none.
Thank you.
You're
Thank you
welcome.
so much. Thank you. And for you to get this book, you can obtain this book from Amazon. It's a bestseller on Amazon.
It is. I remember.
It's a
I remember.
bestseller on Amazon.
Yeah.
You, as a new nurse, you need to get your copy.
Mhm.
If you're a friend of a new nurse, you need to get a copy for that person. And if you're a seasoned nurse and you're transitioning to another area, you need to get a copy. And if you are general population, I would say you need to get a copy because there's some tidbits in there that when you go to the hospital, you can be looking for from your nurse or your interprofessional team. So I also want to say thanks for listening this afternoon. I want to say thanks for coming on.
Yeah.
And I would say professor. I would say professor, pastor, clergy, nurse, and all the other attributes. Thanks for coming. Thanks for
You're
taking time out
welcome.
from Chicago to New York. I appreciate you.
Amen.
And may God continue to bless all your endeavors
Amen.
and success
Amen.
will be
Thank
yours
you.
and
Thank
continue
you.
to be yours.
Thank you.
Be blessed. Right. Remember to get your copy. I'm the host for Empowering New Nurses. And the book says, Nurse, the guide to empower new nurses in the delivery of high quality care to all patients, as we have covered. You can connect with me on YouTube at Miriam Amanda Smith, on Instagram, Podcast Mary, and on my website is Empowering New Nurses, and podcast Empowering New Nurses. You can't miss this. Drop a comment, subscribe. Thanks again. Bye.
Bye.